Hey guys, Steve Wise here, president and founder of Mental Fitness LLC. I'm doing today's video because May is Mental Health Awareness Month, and what I'd like to do is go over kind of where we're at with our mental health in America and what we can do to improve it. So first off, where we're at. Unfortunately here the numbers are not good. As of 2017, we had 158,000 deaths of despair. We had 70,000 overdoses, 47,000 suicides, and 41,000 alcohol-related liver disease deaths. These numbers are so bad that our life expectancy has actually gone down for 3 years in a row, despite gains in medical technology. And this all happened before even our current pandemic. When you look now at the effect of the coronavirus, what we're seeing is that because of the isolation and the job displacement that we're having and that we're needing to do to keep ourselves physically safe with social distancing, our mental health is suffering. Where it used to be that 1 out of 5 people could have a diagnosable mental health disorder at any given time, it's now 1 out of 4. And in some age groups, we've seen a 700% increase in mental health symptoms, to the point where crisis lines are quite frankly even overwhelmed right now with people struggling with isolation and job loss and the depression that comes with that. I wish I had better news. I wish I could tell you we were doing much, much better with our overall wellness and mental health, but unfortunately at the moment we are not. However, that is not to say that there's nothing we can't do about it. There's actually a lot that we can do. First off, we can petition our politicians to invest more in mental health so that crisis center lines aren't overwhelmed and people can reach out and talk to someone if they need to in a time of crisis. We can, on an individual level, reach out to those who we think might be struggling or suffering. This is probably the best thing that we collectively can do to prevent a huge mental health wave to come. If we can proactively just reach out to loved ones, check in, ask them, how you doing, how's life, and give them a listening ear, right? I, on a fitness perspective, prefer to go out for runs. But if I can't do that, going on a treadmill or riding an indoor stationary bike is infinitely better than doing nothing. Right now, because of coronavirus, we have to keep our social distance, and that makes sense. But that doesn't mean we have to be disconnected from one another. We can still reach out. We can still connect with people and show them we love, we care, and we're here to support them. So when we look at actually life expectancy, there is one group of people in the world who live forever. Okinawans in Japan have the greatest life expectancy of anyone in the world. And the best predictor of a long life is not how many fruit and vegetables you eat, how much sleep you get. What it truly is the strength of your social bonds throughout life. When we look at America, what we see that our floor space of our homes is increasing, but that our close personal friends are decreasing. This is not making us happier. So what we can do is we can be more like the Okinawans. Okinawans, in the beginning of their lives, are assigned what is known as a Moai. And Moai is a fancy word for their life tribe. They're assigned to a tribe of people who offer them financial support, emotional support, spiritual, mental health support, all throughout their lives. So whenever they're struggling, they have the collective support of one another to get through it and to grow and to thrive. This to me makes a lot of sense. This is what we ought to recreate in America and what we can start creating now in our own personal lives to reach out to the loves we love, to reach out, to listen, to let them know we're here for them, to connect with them. If you're struggling yourself, please reach out. There are professional counselors who can help if you don't have kind of a Moai of your own. And, I know it takes effort. It's not easy to hop on the treadmill. It's not easy to exercise. Social exercising isn't necessarily easy either, but I would so very much encourage everyone to do that right now. So then that way, maybe if we all reach out to one person and we touch some of those people who are struggling, we might be able to curb that trend on the deaths of despair. We may be able to help people know that they are valued, they are important, they are worthy of our time and effort. And that is my message for today, to help improve our mental health, not just in May, but for a long future to come. Thanks for listening.